report because the former Minister of Health, Dr. Oko Boye, is rejecting the demand for the Zipline contract to be terminated. Now, Dr. Oko Boye joins us live via Zoom to speak to us on this. Doc, thank you so much for this opportunity. The majority leader believes that a Zipline contract is a waste of taxpayers' money. What say you?
Well, thank you very much, my brother. You know, Honorable Mama Yarega is like a senior brother to me. So I want to be careful how I describe the situation. But to be honest, the way he's speaking, he says, I don't like the Zipline contract. Is it that he's speaking from emotion or is from reasoning and the facts on the ground? The way he's talking, with all due respect, it looks like he doesn't even know how the Zipline thing operates. It's not like you have a doctor with a drone in his house, putting medicine in the drone and flying it to a hospital. That's not how Zipline operates. So let me quickly say that, with all due respect, he's speaking from a very uninformed position. And I think we need to take the opportunity to do some education. Number one, every health system, like we have in Ghana, has some gaps when it comes to medical supplies, it comes to emergency medicine. So in Ghana, somewhere 2018, 2019, I think officials in the INPP administration had an encounter with the Zipline company in the US, where they were able to show that they have a solution to these gaps in emergency services. Now, what is the solution? They have a system that makes it possible to transport emergency medicines, vaccines, and other medical products. Because it's by air, they are able to do it sometimes at a quarter of the time that traditional road will take. So if, let's say, you have a village far away in Jirapa, in the Upper West region, that is, let's say, about 3 hours from Wa, which is the center. The Wa Regional Hospital is a big hospital. If a village far away needs some medicine to prevent a pregnant woman who has delivered from bleeding to death, instead of traveling 3 hours to go and give that medicine to the health center at Jirapa, Zipline, if they have that facility mapped to their system, can drop the medicine at Jirapa within 15 minutes.
Right.
Now, so at the end of the day, they don't only transport. Remember, Zipline also serves as more or less like a medical store. So what happens is that if they have 6 stations in Ghana, places where they take off from, each station, if the station, let's say, covers 3 regions, they work with the regional medical stores in those 3 regions such that they have emergency medical supplies, blood products, all at their station. They also have a cold room, keeping vaccines, anti-snake serum, and all that. So if you call Zipline, in the past, you would have called, let's say I worked in Chebi Government Hospital when I was a house officer, a medical officer, sorry. If I needed, how do we call it, anti-snake serum, someone has come to the hospital with a snake bite. If we don't have it in our stores, usually you don't keep it because, how do we call it, it's not all the time you get snake bites.
Right.
I would call Koforidua, which is the regional hospital, or the Eastern Regional Medical Stores. If I made a call, they will now try and get it. If I'm lucky and get it, they will ask a driver to drive from Koforidua to Kibi, which is about 2 hours, making those calls, arranging for the anti-snake to save the life of the farmer who has been bitten by a snake, and getting a vehicle can all take 4 hours.
Right.
But because you have Zipline providing storage for these drugs, all I do is you WhatsApp Zipline that as I speak, I'm at Chebi, I need anti-snake serum. Within minutes, they put it in their flight and drop it in Chebi in about 15 minutes instead of the 3-4 hours of arrangement. So all I want to say is that this solution has been of great help to this country. And with all due respect, I think we should be faithful to the facts and less of politics and emotion. Let me give you some facts. All these facts I'm about to give you are available to the Ministry of Health of Ghana now as I speak.
Very well. Please go ahead.
Zipline, since 2019, that they started services, have had about 800,000 flights.
Okay.
at their 6 stations that cover the whole Ghana. They have a station at Omenako in the eastern region that covers eastern region and southern Volta. They have a station where flights take off at Mampong in Ashanti region that covers Ashanti, Bono, and Ahafo regions. They have a station at Vopsi in northeast that covers northern Ghana, northeast, and upper east. Zipline has a station at Seshuri also, which makes flights that covers the whole of western Ahafo and Bono. They also have one at Enum and at Karachi. Since they started operations, they've made 800,000 flights. Out of these 800,000, 20,000 are blood flights that took blood and blood products. My brother, 20,000. These 20,000 involves Ghanaians, pregnant women who were bleeding to death in the night, sent a message to Zipline and had blood that saved 20,000 products. As I speak, they've done about 30,000 flights that involved anti-snake for our compatriots who are farming hard in some of the rural areas who got bitten by snakes. They also sent anti-rabies, those that get bitten by wild animals. All these statistics is there. The Minister for Health, the ministry, they have these statistics. Oko Boye's position is that if you claim, you see, they should clarify what their problem is. Is the problem the cost of the service? Remember, the cost of all these 6 stations that cover the whole Ghana is about $6 million a year. That is 1 million per station average. Now, you have a 6 million for arrangement that makes it possible for you to reach out to even island communities in Afram Plains in the night. You have a facility that is helping to provide emergency care to save your citizens across the country. Are you saying that the 20,000 people who got saved through blood delivery, are you saying that the 170, the 6 million, let's say, if you convert 6 million to the current rate, 66 million Ghana cedis? Are you saying that the 66 million is more than the lives of these 20,000 people? All I'm saying is that we should let our emotions and politics go down. If you think the cost of the service is too much, come forth and say that you have another competitor who can deliver and cover the whole country at half the price. I am willing to listen and see what that competitor can do.
Well, that's the suggestion he was making for the Ghana Health Service to be, if you like, upgraded to be able to provide the service.
You see, we have to be careful. The way sometimes some of my brothers and sisters in the NDC talk is funny. A country like the United States of America, the most powerful nation in the world, their government contracts private entities to do work for them. Elon Musk is sending people to space and being paid by the American government. Why is the American government not putting money into rockets development and aircraft and space? It's because when you do it yourself, your efficiency as government sometimes is not like the private person. And secondly, sometimes you even put more money than a private person will do. Number two, Rwanda. When I was a member of parliament, I was on the health committee. We went to Rwanda to study the work of Zipline. That's where they started. There are countries that are started before us. But because of our commitment and our willingness to cover all our vulnerable people, as we speak, the whole Ghana has been covered. Our network now is even bigger than Rwanda. Look, I'm a politician, so I know the politics in this. Some people think that over the past 8 years, MPP has made a lot of noise about going digital and Zipline and all that. So some people have some emotional hatred for Zipline. We should take away the emotions. Look, if you are not careful in your bid to discredit or to throw away Zipline because MPP person talks about it or whatever, the guy at the front place who has sent the wife to the maternity ward this evening, when they start bleeding and they call, they might bleed to death. If you are not careful, yes, let me land.
Land on this one.
This talk that we should get drones. With all due respect, talk to IT people. It is not the drone that makes Zipline. It is the software and the technology they have, which makes it possible to put over 3,000 health facilities on their system and are able to fly a miniature plane that drops a drug right in the hospital compound using satellite from space. Please, the majority leader should be told that it is not a drone that is being controlled manually from somebody's house.
Very well.
It is applying satellite technology, the same technology that the U.S. Air Force uses to land planes on their warships. So the MP needs a lot of education, with all due respect. And, and I feel sad that people are trying to condemn a policy that is saving lives when they don't even understand the operation of the policy.
Dr. Oko Boye, just a quick one, and I'd be grateful if you'd be very brief on this for me. You mentioned that you're a politician, and so you understand the politics. What do you see happening? What do you think is going on? First, light wave, now zipline.
My brother, it's just it's a situation of call the dog a bad name and hang it. It was started under MPP. This funny talk of, oh, maybe because it was started under MPP, two things. Someone in MPP, maybe when they get paid, get some money. Or number two, if it continues to say, MPP will continue to say that they brought Zipline. Throw it away so that it's off the books. Nobody can refer to it. And then if there's any money, nobody will get it. If you focus too much on your enemies or adversaries, sometimes you kill your friends.
Dr. Bernard Oko Boye, thank you.
I'll tell you for a fact, most of the people living in these rural areas who are benefiting from emergency support from Zipline, most of them voted for the NDC. And so the NDC should be careful in a haste to throw mud at their opponents thinking that they are doing them. They will end up hurting those who brought them to power. That is my advice to them.
Dr. Bernard Oko Boye, thank you so much.